Much for joining in. Today we are going to actually discuss the blueprint to achieve your ADC dream. I've compiled this little document here which will help you have a clear vision and the roadmap of your journey ahead. What you should expect from the ADC exam. What is this journey about? What should be your 3 steps to register and become the practicing dentist in Australia? And then I shall tell you what should be your methodology, how you should proceed, what preparation you should be doing, what material you should be focusing on, and based on the time available in your day and your routine and your lifestyle, what are the most important material, and then what can be the secondary material which can help you to achieve even higher grades. Hello all. So I'm going to start in few seconds. So it is mostly for those candidates who are now planning to prepare for September 24 or March 25, or maybe you are still thinking about when to take this exam. This is exactly for you all, which will help you to actually calibrate and understand the whole process and then see and help you make decisions. So in today's session, I'm going to be talking about what the ADC process is about, what are the 3 steps of registration, then what is the new pattern which is applicable from September 21. The SBQs are same, but how the exam is basically dividing the framework of the questions, what are the clusters, what are the percentage of various disciplines that keep getting asked in the exam, what are the domains and the clusters, what areas of the entire management of the patient gets asked more, and then what are the past percentage of the ADC exams, how difficult or easy it is to crack this exam. We'll also talk about logistics here. So I predominantly will be focusing upon what you should be doing and focusing on for your preparation for ADC exam. So the ADC exam process basically has 3 stages. As everyone knows, you have the initial assessment. I know some of you may be going through that or maybe planning to apply for that. After that is your basically assessment of the documentation in your country where you were actually registered as a dentist, right? Where you did your dentistry, your undergrad, and then where you were registered from your native country. So it is the assessment of your documentation, a method by which they assess and see your eligibility for the ADC exam. There are certain documentation which is required from you. After you complete the initial assessment process, then you go on for the written examination, which is the ADC Part 1. For the written examination, you are judged on your various disciplines from general dentistry. After you clear your ADC Part 1 exam, then you go on to take the practical examination, which is your skill assessment. It also has a communication component, which is known as your OSCEs, plus your skills, clinical skills assessment. So right now, today, we will focus mostly about the ADC written examination, which is the Part 1, which is the second stage of the ADC exam. How basically you should be preparing for that, assuming that you have either finished your assessment or during the process of it or planning to start it. But your Part 1 preparation, the written examination preparation, should begin along with that. Right? So usually you know that examination happens twice in a year, which is March and September. And now you're looking at the September 2024 examination. The March 24 exam is over now. The September 2024 is what you're looking at. Some candidates may also be thinking to go for the March 25, which is also a good approach, given that if you're a busy professional or you have extensive responsibilities at work or home, given that you may also consider for a 12-month or a 10-month preparation. And if you have free time, maybe you have 6 to 7 hours per day to accommodate, and then I would suggest that you should go for the September 24 exam. But it also depends on various factors, depends ultimately about how much time you can spend per day for the preparation. But I would say that if you only can take out at least 6 to 7 hours per day, then you should aim for the September 24, because best is to, when you go for this exam, go with the best preparation and clear it in your first attempt, right? Better to go full prepared with your best preparation rather than half prepared or just to attempt or just to see, because I know everybody is investing their hard-earned money. So rather to give just a trial attempt or maybe half prepared attempt, it's best to fully dedicate your time period and commit yourself for this process and then go for it, right? That should be your ideal approach for whenever you want to take September 24 or March 25. You should fully dedicate and decide that this is the time frame that I'm going to take this exam. This is what my lifestyle and current responsibilities allow me. How much hours do they allow me? And then you commit for that particular exam, right? So understand that this exam may not be extremely difficult, it is doable, but it is quite competitive now because the number of people who are taking the ADC exam is increasing over the years. I'll come and show you the statistics eventually as well, how the number of candidates taking the exam is increasing, yet the ADC pass rate is reducing. So we know that on the examination day, the exam is conducted over the 2 days, basically, right? And there are 280 questions which will be asked over the 2 days. One would be section 1, 2, 3, and 4. Divided in 4 sections, the 280 questions get divided as 70 questions per section, right? Initially, they were called paper 1, paper 2, paper 3, paper 4, which was subject wise. That distinction doesn't apply anymore. It is only section 1, 2, 3, and 4. No distinguishment between the subjects. All the disciplines get asked in every section. All scenarios are multidisciplinary. Even in the same scenario based questions, you would have a variation of oral medicine, you would have general medicine history there, then you would have an extraction, pregnancy history thrown in, a prosthodontic problem, a periodontal problem going on. So every scenario based question on its own also is now multidisciplinary. Yes, it can have like a dominant discipline dominating the overall management or the chief complaint, but everything is put together now. The oral medicine and the general medicine, the drug history, the medical history is always in the background given to you. So every question, actually the scenario based question, becomes a multidisciplinary one for you to attempt. So every section would have multidisciplinary questions, yet of course you will have some patterns in the exam, like on the first day when you take the section 1 and section 2 and you find that not a lot of ICG questions were asked, then you can automatically expect the section 3 and section 4 to be dominant in the infection control guidelines, because definitely there is a distribution of percentages, how much per discipline is asked, so they will keep up with that. So I will come to that as well now, so which will help you on few days to anticipate, or after seeing the first day section, what predominantly will be asked the next day. That is why for every SBQ that you attempt, because of the oral medicine history, because of the general medicine history and the drug history, the therapeutic guidelines will form the background of every scenario based question. Does that make complete sense for everyone here? That if you look at 280 questions or 56 SBQs, each would be laid on the framework of therapeutic guidelines. And then on that particular framework, you would have chief complaint of prosto, of operative, or of perio, or maybe the implant work, right? So if that gets overlapped on it, then the chief complaint could be from any of the discipline overlying on the background of the drug history and the medical history. That added knowledge comes from the ODEL. ODEL teaches you that understanding of the chief complaint, which could be a prosto component, oral surgery component, perio component, operative component, endodontic component, but with the background of the oral medicine and background of the general medicine, background of the drug histories. So ODEL teaches you putting the disciplinary approach, handling the chief complaints with an entire history, knowing the steps by following the chief complaint. What investigations will you do? Those investigations will lead to the correct diagnosis, and then the correct diagnosis will help you achieve the correct treatment plan. And treatment plan should always be invested with the health promotion and patient education. And all these four things should be done with the correct ethics and correct professionalism. Does that make complete sense if I explain it like that? When you are given a particular SBQ and a chief complaint with an underlying background of a therapeutic guideline, medical history, oral history, drug history, and the chief complaint could be of endodontic, operative, or your extractions, oral surgery, then your implants or prosthodontics or any discipline, right? But then the chief complaint leads to the investigations needed. Investigations lead to the differential diagnosis and the most provisional diagnosis. And then the diagnosis leads to the correct treatment plan. Treatment plan should also be overlapped with patient education. And these four steps should be done professionally and with ethics. And that brings us to the clusters of the ADC exam. I just explained to you exactly how the clusters are assessed in the exam. Professionalism, health promotion, clinical information gathering under patient care, diagnosis and management planning under patient care, and the treatment and evaluation. So if these are the four clusters, as you look at the history in the exam and as the 5 sub questions will come for each SBQ, you do understand that all the clusters will be asked as subparts of that SBQ, right? You acknowledge that, right? Everyone with me acknowledges that every SBQ, 56 SBQs would have 5 sub questions, and all the sub questions would be cluster 1, 2, 3, and 4. So as the history is provided to you and the chief complaint is given to you, immediately you interpret that chief complaint and then you apply it to understand what investigations would you do. So clinical information gathering starts from that first question. Is that correct? Clinical information gathering cluster will be judged on those first or second questions, which would be asking about the patient's chief complaint, what investigations you are doing, and eventually how will you reach your differential diagnosis, which is your cluster 3. Once you know the investigations which actually need to be applied to the correct chief complaint, you can immediately reach the diagnosis and management, because after they ask you, okay, what investigation would you do, you'll choose that option. In the next question, when they go, they will say, okay, after you did that investigation, these were the findings, what would be your most likely diagnosis? So ADC questions are also leading. They will provide you the information based on which you will reach your diagnosis. And then after your diagnosis, they'll ask, okay, what would be the treatment plan? They will give you certain patients' behavioral factors or the patient's needs and desires or certain challenges. They will provide you all of that information, and based on that judgment, you would come to a correct treatment plan, because you know, for a chief complaint, for a dental problem, for a diagnosis, there can be multiple treatment plans available. Hardly there are certain cases where are lesions where the drug management is required, where there is mostly specific management. But if there is a prosto problem or a perio problem or operative problem, we all know that there are ultimately various options of treatments available. Cost can be factor, patient's needs and desires can be factor, the time that patient wants to invest on that treatment is also a factor. All this would you assess and apply and then reach the correct treatment and evaluation. Is that correct? So if that's how you reach the treatment and evaluation, then after studying the patient's history entirely, you would also be asked questions on how will you promote health for them? What would be your education for them, and how professionally you will handle them, the code of conduct that you would apply. There can be language barrier, there can be indigenous patients which need to be handled and understood, their problems, where they're coming from, right? Then the patients could have dementia, the patients could have incapacity to give consent, right? A patient could be with various disabilities, right? So patient could be refusing a treatment, a family member could be creating certain challenges for you to achieve the desired outcome with the patient. So there can be so many aspects in the history which can actually affect your plan, and then questions will be asked, how will you professionally handle those challenges? So they are also the factors which are judged upon, right? So you understand the four clusters here very well now, how the four clusters are, and how with each history the sub questions, 5 sub questions would be from these four clusters for sure, right? So there could be repeat 2 for any of the clusters. Maybe there are 2 questions on treatment plan, or 2 questions on investigations, or 2 questions on health promotion or professionalism. That can vary and distribute differently with different SBQs. But the crux is that the clusters 1, 2, 3, and 4 would be the sub questions of each SBQ. That's how the entire framework and design works. Yes? So I hope that makes sense for everyone. So how your therapeutic guidelines basically helps you with understanding and knowing where each component of their drug history, medical history, their disability, or the lesions that they are presenting, everything, the therapeutic guidelines give you a framework where the chief complaint would come and fit, and how the background history can affect the management of your chief complaint, right? That's what makes ADC question complex. If just it was a chief complaint, it's quite easier. What makes ADC challenging or confusing? What makes it confusing is that chief complaint is rather direct, but there are patient related factors, challenges with behaviors, challenges with time constraints, financial constraints, right? Patient related challenges. Then there are medical history related challenges. Patient may be pregnant, right? Patient may have dementia, patient may have dexterity disability, patient may have a family member who's facing challenges and bring them to the treatment. Patient's family member may be financially supporting their treatment and may require some payment plans. So those are your patient's family related challenges. Then medical history related challenges, drugs related challenges. Patient may be on anticoagulants or antiplatelets and may require extractions. Then they may be on steroids, they may be on corticosteroids for long lasting autoimmune conditions or allergies, which may put them under the risk of adrenal crisis. So the medical history and drug history, right? Then patient could be coming with a medical condition, right? He may be an ASA3 or an ASA4, and he may develop an emergency in your chair. All that can happen, and that's what makes ADC questions challenging, and yet I would say so much fun to crack when you're preparing well. If you have the correct broader view, the eagle eye view of the TG, overlapped with the Odell understanding and the basics of each discipline, you understand prosto really well, where what applies, what is the diagnosis, what treatment plan goes there, right? TG is not going to give you the treatment plans. Odell is, yes, there are 50-60 cases which are wonderful examples of each chief complaint overlapping over the varied history, right? So, so Odell is a wonderful 50-60 cases example which teaches you, but it's not enough. Then we have the advanced file and mega master, where we have 5,000 questions, so about 1,000 SBQs for more practice of more questions, more examples basically. So past paper questions will also help you to practice how to practice each chief complaint over the varied history, right? So this is how ADC questions are framed on. This is how you would go on, and this is how you would prepare for each cluster. Then the ADC pass rates have been going down, right? I mean, in 2020, ADC pass percentage was 50% in part 1 exam. In 21, it went to 44, 22, 24, 23, 24 as well. So number of candidates again in 2020 were also less, but these many candidates passed. Every year there is a gradual increase in the candidates, which you all can appreciate, but there is also a drastic decline in the pass rate. Yet, Winsper has been enjoying, because of such extensive in-depth preparation, consistent high passing rates, because of the factor that despite how challenging the exam grew, how much competitive the exam grew, the grooming of the candidates, the preparation of the candidates always was elevated and top-notched, because we knew that the exam is getting competitive. We knew that the more complex questions were coming, so our preparation was also matching up to that difficulty level, I would say. So we've been always transparent with our pass rates. We don't just flabbergast the numbers and say 95, 99% or that kind of pass, because we know what the actual statistics look like, and we always like to be transparent. And I know that even 75, 80, 85% pass rate is also wonderful pass rate, right? Because seeing the 24% overall pass rate, we do not like to falsely represent any pass rates. So what we do with our course is, how the course would be designed is that we take it for the 22 weeks course, and then it would be conducted on our web app. It is a desktop app. We provide all the study materials on Google Drive, and I have hand curated and hand created the Mega Master and Advanced files in the last 7 years, which have more than 10,000 questions combined. Mega Master plus Advanced file have more than 10,000 questions. So they are highly secured file. That's why they are non-downloadable. And the lectures are also provided. There is the library of 150 recorded lectures on individual disciplines, where we prepare you for the basics as well. And then there are Mega Master file discussions. And each week we go live and discuss the current SBQs from our advanced file. Then the lecture timings every week is Wednesday night every week, based on the Sydney time. And we also conduct a full-fledged 2-day exam style mock exam. As you've seen that the examination occurs over the 2 days, the section 1, 2, 3, and 4. 1 and 2 are covered on the day 1, and 3 and 4 are taken on the second day. Similarly, we've created an exact exam style mock, which would be conducted over 2 days, which is your day 1. We will give you 2 sections to conduct, and then the day 2nd, you would be taking another 2 sections. And each section would be given 70 questions. It would be timed just like the actual exam. The 2-hour timing would be there. So this is how we actually throw you in the live exam environment online, and that's how you prepare exactly for how the exam is going to be. Then I have hand curated 150 ADJ articles, which I'm sure you must have attended the class last week on the orthodontic demineralization. Similarly, all the clinically relevant articles we conduct the classes on. And the 5,000 SBQs which are in the advanced file, and close to 5,000 SBQs which are in Mega Master file. So combined 10,000 questions we cover during the course. And next week on 1st April, I'm coming up with a public orientation. We are now launching the app. So I will be showing you, there will be a virtual tour of the app also. I will be showing you all the study materials and the recordings which are available, and even the student forum where you can actually discuss amongst the students, and you can also personally message me through the app. I'm going to give you a live tour of my app on next week. I will be announcing the date and time soon on my group. So please make sure to join my group to get more information on the public orientation. And there are going to be more discounts also coming up. So stay tuned and utilize the opportunity to save something on your savings as well when you apply for the course. So keep a loop on our group, and every day anyways we are sharing the questions, the exam trivia questions. Even if you don't want to join the course right now and considering it for the March 25, still when you join the Facebook group, there we share every day we share exam related questions, the tips and tricks for the examination, which will help you during your self study process as well, right? So I will be sharing, and if any other questions, you can directly message me on the Facebook page or even on my private WhatsApp number. So feel free to reach out to me. And this is how I really think that if you can spend 6 to 7 hours a day, do therapeutic guidelines for the understanding of oral medicine and your general medicine, the drug history, the medical history, and then oral cases, and absolutely the 10,000 SBQs that we have hand created, the Mega Master file and the advanced file, then, and overall you will have to be doing some guidelines as well. The infection control guidelines will go without say, the code of conduct will go. Then we cover also certain ADJ articles in the special topic classes, and we do trauma guidelines where we do all the traumatic injuries in depth. I have covered all the guidelines myself in those classes. So the trauma guidelines, the code of conduct, the bloodborne viruses, and the management of practitioners who have been exposed to the bloodborne viruses, those guidelines as well. Then you have other guidelines which are other than your practical guidelines. So all those guidelines combined with the TG, combined with the ODEL and the 10,000 question bank that I do with the students, I think that combined sets you for success, not just for your part one, but even when my students, they go for part two, immediately feel that they are so fully equipped with the understanding and knowledge, and they clear their part two also in their first attempt. So that's how we prepare you. That's how well we send you off for your part one, so that the force and the knowledge that you gain from this course actually helps you score the part two exam also in your first attempt. So I would say that get consistent with your dream and be ready to work hard. And absolutely, it is doable. Yes, the numbers may indicate that it's a competitive exam, but I'm telling you, it's doable. You need just the correct approach and an eagle eye perspective, somebody who can show you the larger picture, and then how to easily apply the concepts that you learn during the program. You could do it by yourself as well, as I've told you the books that you would be needing to prepare and the approach that you would require and how the clusters get asked in the exam. So I would be happy to now take questions if anyone has. Probably we can keep 10 minutes, 5 to 10 minutes for Q&A. If anyone has questions here regarding anything, please feel free to ask me and I'll be happy to answer them. On the screen, you can see my WhatsApp number. If you want, you can save the number and message me on my WhatsApp directly. I would send you the course details if required. And if you have any other questions on any preparation material or any other exam related concept, please feel free to ask me. And I will be soon giving out the details about the public orientation class, where I will be giving you the full in-depth view into the program, into the advanced file, into the mega master file, all the study material, the app, the recordings, all the classes, the study plan, and a virtual tour of the app itself. So I will be announcing the day and timing for the same. And thank you so much for being a fabulous audience. I will connect with you all soon. Thank you so much for taking out the time here. And you have my WhatsApp number, you have my Facebook page. Reach out to me with any questions that you have, and I'll post the more details about the orientation class soon on the group. Thank you so much. Thank you, guys.